Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to our event this evening where we are going to be taking your questions by chat. I have one of our employees who is scheduled to monitor tonight. So far I haven't seen that she's signed in yet, so hopefully she's not having some kind of a technical issue. If so, I can field the questions on my own, but hopefully she'll be signing in real soon. But we do want to welcome you. This is your first time to our group. We are MedicareSchool.com. We are a brokerage firm that works in all 50 states as well as D.C. We specialize in retirement planning. Tremendous amount of Medicare business. We advise on Social Security as well and investments. And so anything tonight that you would like to talk about, ask questions about relating to Medicare or Social Security, I would be delighted to take those questions. If you're a client, we want to welcome you. I know many of you will let me know from where you are and what part of the country, and so we are thrilled to serve as your Medicare broker. And as always, never hesitate to let us know if there's anything that you need. We will be delighted to serve you. That's really what we're all about, is helping people to make sure that their Medicare, number one, is done properly, done on time, right plans, right coverage, but also that when there's problems, and problems happen, that you are well taken care of. So please never hesitate to reach out to us to let us know. Those of you that are new to our group, you may have come through Facebook or through the YouTube channel, but we'd encourage you to subscribe to our YouTube channel so that you can be updated on everything Medicare. I just shot a new video today. I try to do one or two a week. And we have some other content creators within our company now that are also assisting with the vital information about Medicare. So avail yourself of these resources. No cost whatsoever, free education, and it's thorough, accurate, and I hope that you use our YouTube channel as a resource for yourself and then for other people as well. And so tonight we are going to talk about this $400,000 bill. This is a real case with our company, a situation that came up with a gentleman that had colon cancer. So I'm going to talk about that. But just before I do, just a couple rules tonight. You can start asking me your questions, and please make sure that I can understand your question. Because sometimes some of the people chat in, they're so abbreviated, I can't understand what you want me to answer. So be sure to be thorough enough where I can understand the questions so that I can give you, some good advice. That's the whole purpose of tonight. So I can start putting those in now, and we'll start going through those here one at a time, and I will be able to last till probably about 6:30 tonight Central Time, so about an hour and a half, and so hopefully we'll get just to as many of these as we can. And if I can't get to you, or you have a question that that comes up after tonight, you'll see this number scrolling along the bottom of the screen. Hang on just one second. I just want to make sure that my okay, yeah, Brigitte is on here, so I want to make sure she's going to give me those questions. So I just got a text, so she's available. But if you have any questions beyond this, you see the number scrolling on the bottom of the screen. When you call in, you're actually calling into our home office, which is a suburb of Kansas City, Missouri. The town is called Overland Park, Kansas. Just right across the state line. I actually live on the Missouri side, but our office is on the Kansas side. And you can call in, and we have people there right now even that would be willing to talk to you if you need some more specific guidance. Our switchboard is open 7 a.m. to 7 p.m. Monday to Thursday, 7 p.m. to 6 p.m. On Friday. So it's open right now for another couple hours. So if you need some agent assistance, just please give us a call. Everyone that you talk to at our company, whether it's receptionists, whether it's an agent or customer service team, all of those people I have personally trained. We have 90 employees, and again, we write business all over the country, and we'd be thrilled to assist in any way. All right, so I'm going to get started. Let's talk quickly about this $400,000 case. This is a situation with a gentleman that had colon cancer. And so, as anyone who's been through this kind of experience knows, when you have colon cancer, prostate cancer, breast cancer, lung cancer, any of these types of situations that are cancer, they are very involved and very expensive. And so with this particular case, what we dealt with him as far as his bills were concerned, when you start off and you're having some health problems, you're certainly going to some doctor visits, primary care, some specialist visits. Usually with these things, there's a multiple types of tests that are being ran. There could be scans that are also being ran. Certainly in this situation, we have MRIs, we have PET scans, CAT scans. And so to make sure that there is a proper diagnosis and really kind of targeted where the problem is. And so there's a lot that goes into it just in the diagnostic phase, the diagnostic stage. Specifically of this gentleman's cancer. A lot went into that. And then once we have a diagnosis, prostate cancer, whatever it would be, then we take the, the next stage, and that is normally some type of a chemotherapy treatment, radiation. Many times it's one or both. And so again, that's going to lead to a lot of expense, and that's going to take some time. And then eventually situations where the treatment, the chemo radiation may be helping, but is not getting rid of the cancer. And so there has to be hospitalization as well as a surgery. And that's certainly what happened here as well. If you can hear the dog barking in the background, we have a pit bull, and his name is Chief, and so he is barking at a dog in the neighborhood somewhere. I decided to do this from my home just because of scheduling today, so sorry about that. But my wife will be in hopefully soon and calm the dog down. So with him, we have hospital stay now. We're admitted to the hospital. He has a surgery. Certainly a surgeon's involved. Assistants to the surgeons, anesthesists that are involved. So that whole process of surgery, very expensive. And then we have, of course, all the post-op follow-up, release from the hospital, and then the doctor visits that are included, oncology visits included, more CAT scans to see the success of this. So the whole point is this is a long, drawn-out process. It also is a very expensive process. And so this particular case was to the tune of about $400,000 in total medical bills. Now, this particular gentleman happened to be on a Medicare supplemental plan, and that plan was a Plan G. If he would have been on another supplemental plan, the story would be pretty similar, maybe a little bit more out of his own pocket, but he truly had a G plan. For the last several years, G plans have been the most popular plans. Of course, someone enrolls in original Medicare A and B, and then the financial gaps that exist in that Medicare system, the G plan covers them all except for the Medicare B deductible. So out of pocket on this case of $400,000, he, of course, had to pay his premium. Now, premiums vary throughout the country on G plans. This one was right in the neighborhood of about $150 a month. There are some a little lower. There are some certainly higher. But he was on a G plan at $150 a month. So during this year where he is having this cancer issue, he paid about $1,800 during the year in premiums. That's $150 a month times 12. He spent $1,800. Now on the G plan last year, and that's what this case was about, had a deductible on the B side that's not covered by the G plan, and last year that was $240. So again, we had $1,800 in premium for the year. We have a $240 deductible for the year. So he's a little over $2,040, and that's all he had to be out of pocket for 2024. Though the bill's $400,000, he literally spent $2,040. Now, it is not uncommon sometimes for people to have cancer treatment that carries over into the next year. So had that carried over into 25, it is not. But if it had, then what would have happened, he may have needed to meet his Part B deductible again, because the B deductible resets every January. This year, the B deductible is $257. So had it carried into 2025, he would have to have been that out of pocket. And again, after the B deductible is met, the G plan covers everything else. All right, so a $400,000 cancer situation cost him just a little over $2,000 out of pocket. And of course, he had some medications, had to have a Part D plan, but many of the meds, the chemotherapy, those kind of things, of course, the meds in the hospital are all covered by Medicare A and B and the supplemental plan. And so he'd have some meds that he would have self-administered, but again, those were covered by his D plan. Again, very low cost for that also. And so the point is, if I knew for sure I'm going into my life and I have cancer in my future, I'd be really grateful to have this kind of coverage. There were no surprise costs. It was very smooth. And to date, he survived doing well. And so we're very grateful for that, for sure. Now, had he chosen to not have a supplemental plan, and let's say he would have went the other path that many people go today, and that's called an Advantage plan. On an Advantage plan, and we have a cancer case like this, it's certainly not going to work the same way for sure, because the Advantage plan is more of a pay-as-you-go system. Most people today on Advantage plans are not paying a premium for those plans other than Medicare premium, but they're not paying a premium to the insurance company, and instead of premiums, they pay as they go, copays. And so that this cancer case would have billed out differently. Again, he had a SUP, but had he had an Advantage plan, he had coverage, but it would have looked a little bit differently. Not necessarily it was bad if he had Advantage, but it wouldn't have been exactly the same thing. And so the way this would have worked out on an Advantage plan is he would have paid as he went, excuse me. So when he saw a primary care doctor, probably a zero copay. Every specialist he saw would have been somewhere between $30 to $50 for the specialist visit. When he goes to the hospital, he'd probably have to pay $400 a day. And my point is that pay-as-you-go system normally, folks, and again, he was not on an Advantage plan. Had he been on one, though, what we normally find with cancer cases, and we have Advantage plans, most people on those are going to hit the max for the year. Every Advantage plan is a copay system until you've hit the max out of pocket for the year. That varies. Most PPO plans are somewhere between about $5,000 or $10,000. Your HMOs are going to be somewhere between about $3,000 to $5,000. So on his supplemental plan G, he paid his premium and his B deductible. That was $2,040. Had he had an Advantage plan, he would have maxed out normally. When you have chemotherapy, radiation, surgery, hospitalization, all those things typically will lead to a max out of pocket. So instead of $2,040, that $400,000 bill would have been probably in the neighborhood on an HMO somewhere between about $3,000 to $5,000. On a PPO, maybe somewhere between $5,000 to $10,000. So again, not $100,000, not $200,000, but it would have been a little bit more out of pocket on the Advantage than it would have been if he had been on a supplemental plan. All right, but the money is not just the only issue here. As we talk about this bill, it's not just dollars and cents. It is what was the quality of his care? What was the ease of his care? Were there hoops to jump through? Were there problems that he would face? And so in this case, because he was on a supplemental plan, there were some really nice advantages to it. Number one, on his supplemental plan, he had the right to go to any doctor he wanted to see, any primary care doctor, any specialist, any oncologist, any surgeon, any doctor he wanted to see, as long as they took original Medicare A and B. Okay, so the point is, when it comes to providers, and you have a lot of them with cancer treatment, you can go to any provider as long as they take Medicare. They will take your supplemental plan. They have to. And so the point, the ease of selecting providers and the availability and the limit, basically unlimited amount of providers available, is a very nice aspect of a supplemental plan. Had a person been on an Advantage plan with cancer, they are going to have to go to providers that are within the network, either HMOs or PPOs, hospitals that are within the network as well. So we end up having these network limitations whenever we're on an Advantage plan. So the point is, he paid less out of pocket than the Advantage, but he also had unlimited doctors, any hospital, any doctor he wanted to go to. Also, with his supplemental plan, he never had to deal with a referral. If he wanted to see a specialist, he had the right to call them up, make an appointment. On Advantage plans, especially HMO plans, that doesn't happen. You have to have your primary care doctor set those up and get a referral to see a specialist. And again, not to say you can't see one, but it's a little bit more cumbersome. It's not quite as easy because your primary care doctor is the gatekeeper for the Advantage company, and they're going to select those providers for you. So that's another issue. Another big thing would be, on his plan, he had no pre-authorizations at all. So if Medicare says they'll cover something and doctor says he needs it, end of story. That supplemental company has no say-so, can never interfere, can never delay coverage, can never deny coverage. If Medicare covers, they have to cover. They're going to follow. And again, when you get cancer, those kind of things are going to matter. You don't want your insurance company having any say-so. On the Advantage plan, they have this final say-so 70% of the time. Now, sometimes they'll approve it for sure, but sometimes they don't approve it, or they delay that approval. And so you have to deal with pre-authorizations with Advantage plans, where we don't have to when it comes to supplemental plans, meaning the insurance company on Advantage can interfere, can delay, can deny, and those kind of things are troublesome whenever you're having, being treated for cancer and you're having to deal with battles with the insurance company, and that's troublesome. If we have an Advantage plan, we never deal with that with the supplemental plan. And that's why those of you who watch me know I favor supplemental plans, because I believe that when someone has a serious illness, their care is going to be better, they have definitely more options, and it's much easier to use those plans. Yes, you got to pay a premium for those, but look what you get. No pre-authorizations, no networks, you don't have to change plans, they're permanent. So there's a lot of neat features that come with a supplemental plan, and you would find that out if you had a cancer case like he did. Do you still have insurance with the Advantage? Absolutely. Is it terrible? No. But it is going to work differently than original A and B with the supplemental plan. You got to pay for that. Supplemental plans have a premium. Advantage plans do not. But I think you get a lot of bang for your buck as far as the quality of your insurance and the options that you have with those supplemental plans. Okay, and so that's the topic for tonight. This gentleman came out with spending a little over $2,000 out of pocket on a $400,000 medical bill medical bills with his particular cancer case. All right. Okay, so enough of that. Listen, I want to take your questions now. And Brizet, if you could tell me exactly what the first one is. My problem, Brizet, is if you give me a question, I don't know where to find it. I am really sorry. It shows me, okay, I see it now. Margaret Holm, does Plan G cover foreign travel, immunizations, or malaria medication? Okay, let me tell you how this works. Number one, if Medicare covers something, Margaret, the Plan G is going to follow. When you get a supplemental plan, they follow Medicare. So if Medicare covers a service, your Plan G is also going to cover everything except for the B deductible. So when we talk about foreign travel and immunization, I do not believe that those are covered by Medicare, therefore not by your Plan G. Now, there are immunizations covered by Medicare and your Plan G, but it's not foreign travel. So I think you're going to be on your own with that. Or malaria medication. Now, if you've got a script for malaria medication that can be filled, that's actually going to come through your Part D plan. And just so you know, I've got a little bit of experience on this. I'm not on Medicare yet. I'm 64, not quite 65. But I go to India every year, and I used to be a pastor, so I'm very involved in missions in India. And so I go over and do pastors' conferences there every year. And so love doing it. So I, too, have to get my immunizations always up to date and take malaria medication. And so I know you can just get a normal script, pretty low cost for that. But that, if it was covered by Medicare, it's going to be covered through the Part D plan, not your original Medicare or your supplemental plan. So that's the way that would work. Okay, hope that helps. Let's keep going. Okay, Marvin, appreciate your company, helping out some friends of mine. They raved about the help they received. Hey, Mark, thank you. We appreciate it. I'm glad they had a good experience. I want everyone to have a good experience when they come to our company, especially when you all refer people to us. You're putting your neck on the line too. So we'll try to deliver always. We're not perfect. We sometimes make some mistakes, but Mark, thanks so much for the encouragement, and thanks for sending people our way. We appreciate it very, very much. All righty, how far ahead should I sign up for Medicare? Well, Ray, I think the ideal time is about 90 days prior to turning 65 if you're going to start Medicare at 65. 90 days is plenty of time early. Or if you're going to retire and then start Medicare, meaning you're coming in Medicare after 65, that 60 to 90 day window before you lose the group plan is the perfect time. If someone gets down to the wire, we can do it a week before, but I prefer that 90 day window is ideal. All right, let's keep going. Rivercast Hammond, what is the cost of Plan G compared to Plan N? Is it a monthly fee or a yearly fee? Well, when we quote Medicare supplemental plans, we quote a monthly amount. Now, there are some times that people may want to pay an annual amount. I personally will not do that. I would just pay monthly. I'll do a bank draft, and so it's a monthly amount. So, Rivercat, it really truly depends on where you are. Today, I shot a video, difference between G and N, and it's not posted yet, but I just selected a zip code out of Dallas, Texas, and I compared the G and the N premiums. So in that market, and again, you may be in the Northeast where it's higher, on the West Coast where it's a little bit higher, but in that market, I looked up, I had female rates, a lady turning 65, and male rates turning 65. And the G plans in that market, again, this was the Dallas, Texas zip code, that market on the G plans for the lady was about $115 to $140. Now, I looked at about 12 different insurance companies. We're brokers, so I just took an average. So again, this is a G plan for a lady, female, turning 65, Dallas, Texas, about $115 to $140 on the G plan. The N plan was about $80 to about $115. So the point is that G versus N was about $35 to $40 less a month. Okay, now for a man, all those rates, we just move them up about $10. Men's med sup rates are about high, they're higher, a little bit higher, about $10 a month. So again, that lady was $115 to $140. $80 to $120 on the G plan. So the gentleman's rate's going to be about $125 to $150 on the G, and about $90 to about $110, $120 on the N plan. So that $35 to $40 is about average between G and N. Now listen, in some states I've seen it as high as $100 a month. So again, it's going to vary. So when you call in, we're happy to tell you that. And remember, when you get the G plan, it covers 5 of the 6 Medicare gaps. N covers 4 of the 6 Medicare gaps. N does not cover the excess charges. Excess charges are very rare, so you may never see it anyways, but if you did see an excess charge, then the N plan will not pay it as G will. N also has just a couple of small copays. Every time you see a doctor or specialist, you are subject to a copay of up to $20. And if you go to the emergency room, you have a copay of $50. Again, very reasonable copays. And folks, listen, honestly, I think G and N are still wonderful choices. I don't think you're making a bad choice either way. It just depends on what's most important to you. Some people say, hey, I want most comprehensive. That's the G. Hey, I don't have to have most comprehensive. I just want to make sure I get a med sup plan that's good. That would be the N plan. Yeah, you take a little bit of risk on the excess, but again, it is so rare today. Less than 5% of doctors do it. And again, you're going to have some copays. And sometimes people say the $35 or $40 difference in their budget doesn't matter to them. Others say, hey, I want to pocket that money. I don't want to spend it on insurance. So I think either one is fine. I think they're great, great plans. Let's keep going. All right. Do you have handle clients in Puerto Rico? Well, no. Now, my understanding in Puerto Rico is I don't think there's any supplemental plans there. There may be some advantage, but I'm not even sure about that, and I am really, really sorry. But I know we don't for sure, and I just don't think they're available. I'm pretty sure in the past I've checked on that, but you may want to Google MedSup plans in Puerto Rico, Medicare Advantage, but I think it's just original, traditional Medicare A and B in Puerto Rico. Okay, let's keep going. Okay, I called your office to have you as our broker instead of the one we used 8 years ago. I was told no, unless I cancel my current Medigap policy and start over with you. Well, here's the thing. Listen, number one, that's the way it works because the person who writes the insurance plan is the agent of record. And that's the one, of course, who gets paid a commission. That's the one who services you. And so if you have another agent that wrote that plan, the only way that we can become the agent of record is if we write a new plan. And so we can't accept transfer of agent of record. We'd be happy to do that for you, but the only way we can do it is if we write a new plan. So if you're happy with your plan, then stay there. And I'm sorry that broker doesn't take care of you, but you can still come and be a part of us and learn and all that. And then if you have any problems where the broker maybe is no longer in business, then you should be able to call that insurance company direct and be able to deal with them and their customer service. But we have to be agent of record in order to be able to help you. That happens when we write that case, we write that plan. Okay, but hey, be a part of our family here through Facebook and YouTube, and we'll do all we can to assist you. Let's keep going. All right, turning 65 this November, expected IRMAA letter for the rate of 2026, but we'll be out of state in December 25. Question, what's IRMAA timing and best rate to handle? Okay, very good. Well, first off, when you apply for Medicare, so again, you're turning 65 in November. So let's back up the clock 3 months, October, September, August. So if you are going to start Medicare at 65, then August 1 on, you can enroll into Medicare. Now, if you're already on Social Security, which you're probably not, but if you are, then that card's going to show up in the mail about 100 days before your 65th birth month. So here's my point. If you're going to apply for Medicare in August, and you request Medicare to start at 65 November, what will happen is that application will be processed. Once it's been approved, then Medicare will send a notice to the IRS letting them know that you are starting Medicare, and then the IRS will report back to Medicare what your modified adjusted gross income is, which will then establish what you'll pay for Part B. So if you're above the thresholds, those income thresholds, then and you have an IRMAA, then that IRMAA letter is going to come to you probably sometime around October. You'll get a letter and they'll say, or maybe September, but probably October, right before you start your Medicare in November, and it's going to let you know what your Medicare B premium will be, including the IRMAA. So you'll get the letter. And then my recommendation is within 10 days, they like to have you, if you're going to appeal, you ask for a reconsideration. And so the form you're going to use is called an SS-44. And there's 8 appealable life-changing events that we use. Those are death, marriage, divorce, work stoppage, work reduction, loss of income producing property, and loss of pension income or an employer settlement agreement. There's 8 of them. They're all on the form. Okay, so you select which one, the life-changing event, if you have one of those 8, and then instead of them looking back at 2023 income, you can ask them to look at 2024 or project what you're going to make in 2025, and they will reconsider your IRMAAs. And so if you win the appeal, and you will as long as the events in the last 2 years and your numbers have changed, they will send you a letter back saying, okay, we're reducing your IRMAA to 0, or maybe you're at a high IRMAA level and you're going to be going down maybe a stage or 2. That's the process. That's the strategy. But listen, you cannot appeal an IRMAA until the life-changing event has occurred. It can't be something in the future. It has to be something in the past 2 years. And so that's the strategy. You work with us. We'll be happy to give you more assistance on that. We help people with IRMAA reconsiderations all the time. All right. Hope that helps. Let's keep going. Okay, William, if you have A and B only, could some providers balk at providing services since they might be afraid of not getting the 20% balance? Hey, William, I have never experienced that before. I've never heard someone have that. I guess it could happen. I do know that only 10% of all people that are in Medicare even have A and B only. And so I think it's possible. Like I said, I've never heard of it for sure. I think it's not bad. I think it's the worst option, not just a bad. I think it's the worst option having A and B only just because of the financial liability if someone had a serious illness. Okay, so sorry, it's never happened, but I suppose, yes, sir, it could. All right, help. Can I get SUP back in SEP period without underwriting? Turned 65 January 2025, signed up for Medicare SUP and drug plan in November 24, approved and paid January premiums, error in talking, had husbands. Okay, hey, Ren, do me a favor. I can help you, but you're a little bit too abbreviated for me. And so getting SUP back, and I know what an SEP period is, but here's what happens. Let me share this with you. I don't think you're in a mess because you said you turned 65 January 2025. If that's your B date, Ren, you still have 6 months of your B date to qualify for a Medicare supplemental plan with no underwriting. So you don't have to use an SEP. Okay, you're going to use what is called the Medigap OEP. So you're still within 6 months of your B date. If your B date's January, which I think that's what you're saying, you signed up for Medicare, SUP and drug plan in November 2024. So, but your birth date was in January. So it looks like to me you just simply signed up in advance, paid your premium in 2025. Error in talking. Okay, you're not telling me enough. Okay, I will help you. But if I'm interpreting your case properly, there we go. Continue employer med coverage. Took form 1763 to SS, drop off B, kept A, dropped SUP and drug plan by phone call. Do I do SEP? Okay, very good. Well, number one, now I understand. Now, number one, if you're going to keep working, then it is fine to have dropped the B. It's fine to do that. So if you have a good group plan, if you or your spouses, just stay on that plan. Now, once you're ready to retire, then it is true you're going to have to fill out the SEP paperwork. But listen, as long as you have had coverage at work or Medicare back to 65, you're going to qualify for an SEP. Ren, so I don't think you have any reason to panic here. It's fine to do what you did. It's fine to drop sup plans and drug plans if you have a good group plan. As long as there's 20 or more employees on the payroll, you should be fine. So you do have this SEP to re-enroll into Medicare, and that's going to last. Your birthday was January, so you got all of February, all of March, all of April to do this. So I don't think you need to panic. If you don't want to stay on the group plan, you want to come back in, you can do that. And Ren, call us. Let one of our agents walk you through the whole process and make sure everything is done on a timely basis. But I don't think you're in a panic mode here. I really don't. I think you're fine. You're still within that IEP 3 months before you turn 65, month of, and 3 months after. So you're still fine to make some decisions and undo some of this stuff and make corrections. So you are fine. Okay, call us and we can get the process started again for you and do it on time properly. Okay, let's keep going. Alrighty, Marilyn, what is the food allowance people calling to get me to sign up for? Okay, what that is, Marilyn, is that would be a perk that is from some of the Medicare Advantage plans. When Medicare Advantage plans market their plans, what they do is they really place a huge emphasis on some of the perks. The perks would be gym membership, dental allowance, hearing aids, this food card. And what they're doing is they're emphasizing all these things, saying, hey, we'll give you all these things. But Marilyn, what they're not doing is they're not going to tell you how that plan is going to work. They're not going to talk to you about the limitation of networks, the pre-authorizations. The plans can change every year. So there's some negatives to Advantage plans that you need to be aware of. Now, that doesn't mean to say an Advantage plan is not a good fit for you. It may be. But all I want to make sure of is don't bite the carrot for this food allowance. On Medicare Advantage. It's real. Now, the majority of people who get really a substantial benefit are those that are on Medicaid and Medicare. Most of the people are just on Medicare only. If they get a food allowance, it's going to be very minimal. But again, that's someone marketing, trying to get you to bite the carrot, to get you to enroll in an Advantage plan, because Advantage plans pay us as agents very high commissions. And that's why agents push them. Insurance companies make billions off of them from the Medicare system. So that's what's going on. And so all I'm saying to everyone listening, don't just look at the perks. Look at how the insurance is going to work. How will your insurance work if you get cancer? I can assure you get cancer, you're not going to care about your gym membership. You're going to care about your network. You're going to care about pre-authorization. So make sure you look at all the aspects of how that plan is going to work, not just how big is the food card. Okay, I think that's just marketing. That's all it is. Okay, let's keep going. All right, if I have Fed Blue, FEHB Blue, got it, and Blue Shield Basic Plan, do I need to get Plan G? Mary, not necessarily, and probably not. If you have a good premium on your Fed Blue plan, if you're on Basic, I know it's a good plan. So what's happening with you enroll in A and B, you get Fed Blue to pay second to Medicare. And so in that case, Fed Blue is probably going to give you about $800 a year credit. If someone's on GEHAL, they do the same thing. And so that's very good insurance. Now, I've had plenty of people who were unhappy with their government plan, and they wanted to get a Plan G. But you wouldn't have all of that. That's too much insurance. And so the issue with getting a Plan G for you, Mary, is if you get a Plan G, you're going to have to terminate permanently your FEHB benefits. You don't just suspend them, you terminate them. You have to fill, there's a form, it's called like an RI 77 or something, but it goes to OPM, and you actually have to terminate your FEHB benefits. And then, of course, your annuity payment is going to go up because you no longer have to pay for your Fed Blue, and then you can get a normal MedSup plan. But you're not going to have both. It's one or the other. So you want to make a comparison. What's it cost you on your Fed Blue versus if you had a Plan G? And then you got to be comfortable terminating that. Now, let me just quickly say to anyone that's on FEHB, we have a lot of people today that are on FEHB. And what they're doing is staying in FEHB, but they're getting what's called an MA only plan, Medicare Advantage only plan, because Fed Blue will coordinate benefits with the Medicare Advantage system, or they'll coordinate benefits with original Medicare. And the reason that some people will do these MA-only plans is because you still stay in the government system. You don't terminate anything. You don't suspend anything. And then you get some of the perks that they like that come with the Advantage plan. And so there's a lot of people doing that. It's called MA only. And I'm going to mention one more thing. A lot of reason people do this is because with those MA only plans, because you get your prescription coverage through FEHB, that Advantage plan will give you some type of a credit towards your Part B premium. Some of those are $175 a month. It varies, state to state. But veterans and Tricare and FEHB people can get MA-only plans, and then they get a Part B give back. So FedBlue discounts you. The Medicare Advantage plan also gives you some money, so it pulls that Part B premium down pretty low. Now, to do that, you've got to be comfortable with that Advantage plan for sure, but that is another option. But I wouldn't say A and B, FEHB plus G. I just think that's too much. I really do. All right, hope that helps. Federal employees are in a very unique position. They have more options than anyone else, and it does get a little bit complicated. All right, I'm ready. Okay, I have some property that eventually I'll have to sell, taxes. If I take the money and put it into my 401k, would I be able to avoid IRMAA charges, to my Medicare? Well, if you're able to put that in to your 401k, if it goes in, eventually when it comes out, that will be taxable. Again, I'm not an accountant. I'm a financial advisor, so I'm aware of a lot of tax issue. So what you're saying is that presently you're going to put it in there to avoid the taxes. So yes, you could. But when it comes out, it will affect IRMAA because the IRMAA is all of your income, all of it. Earned income, non-earned income, all that's going to go into. So once you start to take distributions from that 401k plan, it will be reported because the IRMAAs are based upon what we call modified adjusted gross income. Line 11 on your tax return, look it up. Line 11, that's AGI, plus line 2A, which is tax exempt interest. Those two numbers are called modified adjusted gross income. That's what Medicare looks at to establish what your IRMAA is. So maybe you can have some relief temporarily if that's even possible to do this, but eventually it will have an impact. Okay, let's go. All right, I'm a Kansas resident, turning 65 in June, currently fully covered under my domestic partner, common law wife. Which Medicare plans A, B, C, etc. do I need to register for? Okay, so here's the way this works. You are going to have to enroll. Well, let me back up and say this. When it comes to your Medicare options, in order for you to be able to get a Medigap policy with no underwriting, what's going to happen is you're going to have to get that within 6 months of being 65. Because in Kansas law may, with other insurance, say that you can be covered by a domestic partner, common law wife. But when it comes to Medicare, it doesn't work that way. You are going to have to go on A and B at 65. And if you want a supplemental plan, without underwriting, you're going to have to do that within the 6-month window. You're not going to qualify for an SEP enrollment into Medicare. You just will not. Okay? I've checked into this before. So my point is, you're going to have to start Medicare at 65. And at that time, then your B date will begin, and you'll have 6 months to get that Medigap policy. So you do not want to miss that window of opportunity. I've had people in your situation who were hoping that they could enroll into A only and pick up Medicare B at a later date as an SEP, meaning they could if you were married. Okay, but Medicare says there has to be a marriage license for you to qualify for an SEP to delay enrollment into Medicare B. So at 65, you're going to get an A and B plan with a SUP, or you're going to enroll in A and B and then get a Medicare Advantage plan. All right, and so you say, do I need to register for that? So you're turning 65 in June, really any time now. So we back up the clock, May, April, March. This is the time for you to do this, about that 90-day window prior to turning 65. All right, so you have no SEP eligibility for Medicare B unless you can show a marriage license. Okay, let's keep going. All right, Gary, in 2023, I made $188K. In 2024, I made $169K, but was laid off, retired in November. Would this be considered a life event to help lower my rate to $185 by filing for an IRMAA exemption? Okay, so first off, if you're married, the limit is 212. So I'm assuming, Gary, you're single because you're concerned about the IRMAA. So the first threshold is anything above 106. 106. And that single threshold is 106 to about 133. So you're probably in that second level of IRMAA if you're single. If you're married, you don't even have, if you file a joint return, you don't even have an IRMAA. So I'm assuming you're single and you have an IRMAA. So what's going to happen is, let's see, 2023, you made that. Okay, so you look back. So would this be considered a life event? And the answer is this. It is, but if your income was still at the 169 in 2024, you're still going to be in the IRMAA, that second level of IRMAA. So appealing, what number are you going to give them? If you give them 2024, even though it's lower than 2028, it doesn't move you to the next lower IRMAA. Now, what I would do, Gary, what did you make this year? Because if you're no longer working, what's your 2025 income look like? Because what you can do is you can appeal the IRMAA using the 2024 layoff date, and then you can give them the 2025 income number. So if you're below that 169, or you come below really 133 or below 106, you may be able to eliminate that IRMAA fully. My point is, it doesn't help you to appeal the IRMAA and give them 169K. That still leaves you with an IRMAA. But if 2025 is lower than that, then give them that. And so if it's below 133 or below 106, we're going to lower IRMAA. So that's what I would want you to do. Life-changing event 2024, given 2025 projection of your income, and they will allow you to appeal that. So that's the way I would handle that case. All right, let's keep going. I started Medicare 1/1, thanks Josh Roof. And by the way, Josh Roof is my son-in-law. My daughter, Sarah, is getting ready to have a baby. So Josh is going to be a daddy again. He already has one little boy whose name is Tucker. And I have 7 children. Josh's wife is my second oldest daughter. And so he's a great guy. So I don't know if you knew he's my son-in-law or not, but he's a fine young man, great agent. Okay, let's keep going. I want to maximize my Social Security. I turned 70 in August. Should I tell Social Security that I want to commence payments in August? Month I turned 70 or September. Okay, you want to start your Social Security benefits in August. You'll get your first check in September, but you can't grow it anymore. You've maxed out when you turn 70. So it sounds like you turned 70 in August. So when you go on the application, you can do it 4 months in advance. So back up the clock, July, June, May, April. So anytime after April 1, you can actually go in online if you're going to apply for yourself and apply for Social Security. And so when it comes to the spot where they ask you when you want to start your benefits, you're going to put in there August 2025, and they'll say the reason. Just say, I want to run this to full max at age 70. So that's what you're going to do. And then your first check will come in the month of September. People get their Social Security checks deposited based upon their birthday. So if you're born the first 10 days of the month, you get your check deposited no later than the second Wednesday. The next 10 days of the month, no later than the third Wednesday, and then the last 10 days of the month, no later than the fourth Wednesday. All right, so turn it on for August, get your first check in September. All right, let's keep going. Okay, I have a meeting with Josiah next Tuesday. And Josiah is my son, who also works. One of my sons. I get 2 sons in this business. And Josiah is my youngest biological son. I have 4 girls, 3 boys, and we adopted 2 children from Uganda. And so boy, girl, their brother, sister, parents had died. Anyway, so Josiah's my son too. So man, that's really neat. Josiah is a great kid, great agent too. Works hard. So looking forward to get this task done. He'll take good care of you too. Josiah is normally within the top 3 agents every single month in our company. Many times, last year he was number 1 the whole year. And so I think this last month he was number 2. But he's hardworking and ethical, do you a great job. So look forward to hearing how that goes. Let's keep going. All right, question. If I'm going to consult with another ENT, my main ENT referred me to another ENT, but said it would need to be a referral from her as opposed to me simply calling the other provider. Okay, and that is fine. That is fine. There are sometimes, now listen, Medicare is not imposing the referrals. at all. But sometimes some specialists will not allow you to make your own appointment. They want that coming from a referring doctor. So doctors do that. Original Medicare is not doing that. So I would agree with you. I have seen that before. Yep. With traditional Medicare, can I not just go to any accepting of Medicare physicians on my own without a referral? And so I just answered your question. Yes, Medicare says you can, but sometimes doctors have their own rules just because they're so busy, and they require referral. But it's not Medicare imposing that. It's the doctor's office doing that. All right. Okay, do I have to present A and B cards plus supplemental card? Yes, you do. Anytime you have anything inpatient or outpatient, both cards. Why? Because that provider is going to bill Medicare first. Now, Medicare already knows about your supplemental plan. The supplemental plan notified them, but you give that information to the doctor so they can include that with the claim. It goes directly to Medicare. Medicare pays their part. The balance of that, then it goes directly, automatically, electronically to the supplemental company that's going to pay second. If you haven't yet met your deductible for the year, then you'll get a balance for that. But if you've met your deductible in the G plan, you'll never see another bill again. So it goes to Medicare, supplemental company, then to you. All right, Jennifer, we have cancer in my family. I have a G plan and a D plan. Then I hear you saying that a cancer waiver is not necessary. Okay, a cancer waiver. Okay. When you first go on Medicare, I think that's what you're asking me, Jennifer. When you first go on Medicare, once we've established Medicare B date, that B date is a key date because in every state in the country, you can apply for a Medicare supplemental plan 3 to 6 months before you go on Medicare B. 3 to 6 months before you apply for a sup. Now, your supplemental plan will go into effect on the B date, but if you don't have a supplemental plan yet and the B date has started, we still have 6 more months of the B date to get a supplemental plan with no underwriting, okay? No health questions. You could have cancer and they still have to write that plan within that 6-month window of your B date. Okay, so I think that's what you're saying. So even if you have cancer in your own life or the family's life, it's a non-issue during this 6-month window of your B date. That's called the Medigap OEP. It's a federal law that says you can get any Medigap policy sold in your state, any carrier, based upon your age, of course. So you can get those plans G or N with no underwriting. No health questions asked, all pre-existing conditions must be covered, and they can charge no additional premium if indeed you have some pre-existing conditions. They cannot do that during that 6-month window called Medigap OEP, very important period of time. Okay, let's keep going. Okay, do you know how Tricare for Life compares to Plan G? Well, I think Tricare for Life is good insurance, and by the way, thank you for serving our country. I was also in the military. I have a daughter that's in the National Guard, so we are grateful for your service. And so now that you have retired, you have Tricare for Life. And so what happens with Tricare for Life is you must enroll into Medicare A and B at 65. Now, if you're on Social Security, you'll automatically be enrolled anyways. But if you're not, you have to enroll into A and B starting, you want to begin that on your 65th birth month. Tricare then moves to the second payer position, and it's going to fill in the gaps that Medicare does not cover. Now, my understanding is that with Tricare for Life, you still have some minimal out-of-pocket expenses, but I think they cap that out at $3,000. Okay, and so I am of the opinion that you have wonderful insurance without getting a Plan G. Now, I wouldn't say that to most people because most people don't have Tricare for Life, but you do have very good insurance. So I think to get a Plan G would probably not be what I would do. I would just stay on Tricare. I think it's excellent insurance. I know you have that $3,000 potential, out of pocket where you'd be less than the G plan, but if you had maybe lots of health problems, may consider doing that. But otherwise, if you're generally healthy, I probably would be very content with A and B and use Tricare. Now, I will tell you what a lot of veterans are doing. Retired military people are doing. What they're doing is they will do what's called an MA only plan. MA only is Medicare Advantage only. You get your drugs through Tricare, and then Tricare will coordinate with the Medicare Advantage company. They will, and they'll coordinate with A and B, or they'll coordinate with the Advantage plan. And so when they coordinate with the Advantage plan, what happens, because you get your drugs through the Tricare insurance, you get, again, a Part B give back. And again, that's usually about $150 to $175 a month. So that brings that Part B down, and you're on that MA only plan. So that's a good option. There's a lot of people on Tricare do that today. And the benefit to you also is it's not permanent. Just an annual decision. So if you don't like it and you just want to go back to Tricare with A and B, you can do that in a year during the Medicare open enrollment season. So you actually have a couple of different options, Gene. And if you want to call our office, our agent could spend some more time talking to you about that, so you're real clear. Okay, I'm ready. Keep going. Okay, I don't take any meds. I'm 65 in May. One RC plan, what I need. What RC? I may mean RX plan, what I need. Okay, well, Bonnie, I think you're wise in understanding that you do need a drug plan, even a basic drug plan. So what I would do right now, a couple of the low-cost plans in the market would be WellCare, has a very low-cost plan, decent formulary. We can't write that plan because they're a direct-to-consumer plan. And then Cigna has a very low-cost plan as well. I know that plan in some states is like $3 or $4 a month. So what I would do, go ahead and get a drug plan. Just get a low-cost one, maybe a Cigna low-cost plan, the WellCare plan. And that way, just in case you need a medication that's expensive, it's going to be covered with the 2,000-year max cap now with all Medicare plans. Because there's people that are on medication costs $15,000 a month, and it costs them $2,000 for the whole year on every single drug plan. So as long as that medication is in formulary, it falls underneath that $2,000 cap. So get a drug plan. If you don't get one, Bonnie, they'll begin to penalize you, and those Part D penalties are lifetime. Okay, so get a drug plan. Just get an inexpensive one. If things change, you can change your drug plans every year, October 15th to December the 7th. All righty, who's next? Okay, I don't have a family history of cancer, heart disease, or really any major illness. I have type 2 diabetes, have for 12 years, and managing with meds and diets, supplemental advantage. Well, Tim, here's my view to really everyone. As long as you can afford the extra premium on a supplemental plan, I feel like that is the best quality coverage that you can get, supplemental plans. Yeah, you got to pay for it, but I think you get a lot for a lot of bang for your buck. I really do. I am not anti-Advantage plans. I am really not. But Advantage plans do have their disadvantages, and that is what I've talked about. Pre-authorizations, networks, the plans change every year. So there's a lot of moving parts to an Advantage plan that complicate people's life, especially when they're sick. That never happens with supplemental plans. So you're asking me, what do I think? Even if you just have type 2 diabetes, hopefully that will not become something worse for sure. But I do know this: if your type 2 diabetes were to worsen, would get worse, and you were on an Advantage plan and want to get off of that, once you've been on an Advantage plan over a year, to get off of it, now you have to medically qualify. You got to go through underwriting to get that supplemental plan. So that could pose some type of a problem. All right. So if you can afford it, I would get the MedSup Plan G or Plan N. I think you're going to be happier with that long term. I can tell you this, folks. I have 55,000 clients, and we get no complaints from people that are on supplemental plans. Those that are on Advantage plans have issues. They just do. Now, that doesn't mean they hate their plan. It just means they have more problems, complications. Why? Because now you have a private health insurance company that can interfere, delay and deny services. And when that happens, that's very frustrating. Let me just give you a silly illustration, but it really, I think, illustrates the two options we have before us. Most of you are aware of a Toyota Motor Company. They make a Lexus and they make a Corolla. They make both of those cars, and both of those cars will get you from point A to point B. They have 4 wheels, they have a steering wheel. But the features of the Lexus are different than the Corolla. Okay, they are. It's a different ride, different features. Definitely one's a little bit more luxurious than the other. They're both cars, so they have some of the same function, but they're different. And that's the way I see supplemental plans versus Advantage. I say supplemental plans like the Lexus has some very, very nice features. Cost more. The Corolla will get you there. The Advantage plan will take care of you. You're not going to be, in a terrible, terrible mess, but you're not going to have the nice features of the Lexus when you get a Corolla. It just doesn't work that way. And so you have to live within your means. If a person cannot afford a supplemental plan, then they should absolutely get an Advantage plan. Tons better than having A and B only. Tons better. Okay. But I prefer subs when people can indeed afford them. All right, let's keep going. All right, if I move to a different state, will my G premium change? It can change. It doesn't always change. It just depends. Now, let's say you live in the Midwest and you move to New York or somewhere up in the Northeast, probably going to go up. So what happens is the supplemental plans, all of them, are written for life. Guaranteed renewable, they can never cancel it except for non-payment of premium. The only thing they can change would be the premium if you relocate. So if you move to an area where medical costs are higher, supplemental plans a little bit higher, you will see a rate adjustment up. I've even seen them go down. Some can be in a state in the north and move to the south, the rates are lower, and you can see that rate actually improve. So they do have the right to re-rate you up or down. Okay, but I will tell you, I mean, I have lots of clients and I've had people move for years, and I've never had someone cancel a MedSup plan because of the premium adjustment that was made when they relocated. Okay, hope that helps. All right, so all the G plans are the same. When I call in, should I ask about how stable the rates are with companies to make my decision? What are the important questions? You're exactly right, Jennifer. The reason all G plans are the same, and so are the N plans. An N is an N is an N is an N, no matter who you get it from. A G is a G is a G is a G, no matter who you get that from as well. So they're standardized by Medicare, so Medicare sets the rules for what these plans are going to pay. So a G plan, no matter whether it's from Aetna, United Healthcare, from Humana, Mutual of Omaha, whoever it is, doesn't matter. That G plan, those companies are all going to pay the same bills, same type of bills, same amount of bills. I promise. There's no difference in coverage whatsoever. Now, beyond that, there's differences, and that would be initial premium and then stability of rates. So that's what you're asking. It's the right question. How stable will they be? Now, frankly, Jennifer, not one of us has a crystal ball. We have no idea how stable any company is going to be. But we can look back at the last 10 years to see how stable they've been, and history will probably repeat itself. We also can look at the market share that company has wherever you are. And if the companies you're looking at have a large customer base, we call it a large group, a lot of customers in that area that have the same plan, you have more people then for that risk to be spread out. So if I have more of a local carrier or regional carrier, they might not have as many customers. And if that small group has health problems, you're going to see that in more price increases. But if it's a larger group, we don't see the impact of that as much. So we like national carriers that have a large market share. I care about initial premium, but I'm looking at long-term as well. It's a great question. Okay, as we decide on Supper Advantage, I've heard one should list the doctors you currently see or want to see in the future. Does that mean specific names or types of doctors like an orthopedic specialist? Yes, especially, Carol, if you decide to take an Advantage plan, you should do that for sure, because you want to make sure that all those doctors, even potential doctors, are going to be in the network on the Advantage. With the supplemental plan, you don't have to do that at all. All you have to do is make sure that those doctors take original Medicare. That's it. You don't have to worry about a network at all. And right now they say that 99% of all non-pediatric doctors take Medicare. 100% of hospitals do, pardon me, and 99% of non-pediatric doctors do. Why would a pediatrician take Medicare? They don't need to do that. But 99% of others are going to do that, okay? Hey, you're all going to have to forgive me for just a quick second. I am at a stand-up desk and my back is killing me. I trained agents today and I'm going to move here. Hang on. I am 64. My back is getting terrible. Okay. It's coming down. Sorry about that. It's just, I stood all day training and I'm worn out. Okay, Carol, as we decide on Supper Advantage, I've heard one should, okay, we already talked about that. So yes, every doctor, if you're going to go with Advantage, you better make sure it's going to be in the network. It's a very interesting stat. They say right now, when we look at the average market and you see all the doctors that are available, there's about a 43% chance that half of the doctors in that market will be in your network. Half. So in other words, you're not going to find any plan. I think that the best network on the market right now, they say that about 70% of the doctors in that market are going to take those plans. So at best it's 70%, but on the average it's about 43%. So you're going to have limitations. And what's sad, Carol, is your doctor may be in the network this year, the hospital's in the network this year, and then they can't negotiate the contract next year, and then they're no longer there. And that changes all the time. I've seen networks, I've seen hospital groups pull out Advantage plans mid-year. So those kind of things happen. It never happens with a supplemental plan. And that's one reason I like them. Okay, you got to be able to afford it though. All right, let's keep going. Okay, I had my first call with an associate at Medicare school, and it was so easy and well explained. Oh, that's great. MC, thanks for the encouragement. I hope that's what everyone experiences when they deal with our company. That's our goal, to make sure you're well taken care of. Okay, let's keep going. In your sample 400,000 bill, do you have to pay the hospital deductibles or the supplemental policy covered? Great question. Okay, Hector. Everything on the A side of Medicare, which is the hospital deductible, hospital extended copays, are all covered by your supplemental plan. Your G or N, either one, would cover every gap on the A side. The gaps that are not paid are those on the B side. The G covers the 20% coinsurance, and the excess charges just doesn't cover the B deductible. With the N, it doesn't cover the B deductible or excess charges. Remember that? So the answer is yes. Everything's covered on the A side for sure in my example. Okay. Supplemental plans will cover them. One of your advisors liked Advantage for me because Florida Advantage plans are exceptionally good. Would you agree? Also said supplemental premiums would be $220 a month versus your example. Okay, and you're right. Florida is a very unique state. And I know in Florida, there are lots, there's probably 75, 80 different companies. I mean, tons of different company plans than in most places. The average market right now, let me back up and say this. There's 4,000 Advantage plans in the country this year, 4,000. The average market has about 43 different plans to choose from with Advantage. Florida is probably double that. Which means what? There's a lot more competition in Florida, so we see some of the max out of pockets very low, maybe $1,000, maybe $1,500. So they are very low. So it's difficult to look at a premium of $200 a month or so and pay $2,400 in premium when you can get a Advantage plan with a max out of pocket of $1,000 or $1,500. So that's why the agent was saying that. Now, we still have networks. We still have some of the issues you got to deal with. But most people in Florida find Advantage plans so favorable because of the competition. That competition keeps driving those copays down, those max out of pockets down. The networks are huge. So Florida is just simply an exception. There are some counties in Texas and in California as well that are just like that. They're just tons of Advantage plans that are available. So it's up to you. You know, if money's no object, I'd still get a supplemental plan in Florida. But if money's a little bit tighter, you don't want to spend the $220, get an Advantage plan because of those low max out of pockets. All right, let's keep going. Okay, do I need to go through a broker to sign up for a supplemental plan, or can I go directly to the insurance company? Using a broker, do I call them about issues with my coverage in the future? Okay, Fred, it's a great question. No, you do not have to use a broker. You can definitely go directly to an insurance company. However, I'd say this. If you find a broker like us, and there's others like us, that will generally care about you and give you continuing advice to make sure that you continue to be on the right plan, you actually get serviced. You are not going to be serviced by any insurance company that you call direct. Now, if you have a claim problem, you can call in and ask questions, but for them to make sure you're on the right plan and shop the rates for you every couple years and help you with the drug plan and all that stuff, there's no insurance company going to do that. So that's what we as brokers provide as a service. And, Fred, there's no cost. Let's say you went direct with United Healthcare and they have a plan that's $155 a month. That's exactly the price we're going to quote you. So you don't save any money by going direct to the carrier. What I think you do is you give up a lot of good potential service if you find a broker that will take care of you. Okay, so someone's going to get paid a commission. You cannot get a supplemental plan without it being written by an agent. Even an agent that works for a company is going to get paid. And so I think brokers bring a lot to the table, especially if they've been at it for a while and can continue to help you. We have our own customer service team. You call an insurance company today, you're almost always going to be in the Philippines, India, or China. That's just the way it is. You're not going to be talking to someone whose language is English, at least first language, and who really understands Medicare very well. So go with a broker. I'd love it for it to be us. But if it's not us, someone that you know you like and can trust, it's totally free to you. So take advantage of the system. I would. All right, who's next? On N plan, can excess changes only for doctors or can hospitals? No, the only people that can charge excess is physicians. That's it. So that would be your primary care doctors, your specialists, surgeons can. They're the only ones that can do excess. No, we'll never see excess on the A side of Medicare. We'll never see excess from durable medical equipment providers. Hospitals cannot do it at all. Only physicians. Okay, who's next? Thanks for the session. I have info call with one of the reps next week, but generally, if I already have a retiree plan, does it act the same as supplemental plan for Medicare purposes? Maybe. What I would do, keep your appointment and make a comparison. Retiree plans are typically not supplemental plans. They can be either secondary to Medicare or they can be actually retiree Medicare Advantage plans. So if you have an interest to know, are you on the best situation, our agent will be honest with you. If you're on the best, we'll tell you. If you're not, we'll tell you which other options are, and you can take it from there. So retiree plans, I've seen some good ones, and I've also seen a lot of them that were mediocre or lousy. So take the time to compare. We're happy to help you and give you that advice. All right, who's next? Explain the 15% excess. If the Medicare approved amount is $100,000 and the doctor charges $115,000, do I owe $15,000 to the doctor on Plan N? Yes, that's exactly right. So the excess charge max is 15%. So if the Medicare approved amount for a service would be, in this example, $100,000, that's a lot, then that doc can add no more than 15%. So because N does not cover excess, that would be your responsibility. And that's true. So you see it correctly, Charles. All right, I have state Medicaid along with my AB as of 3/1/25. I'll be off Medicaid within the next few months. When I'm off Medicaid, how long do I have to purchase a Medigap plan? All right, so in your situation, since your date is 3/1/2025, you're still going to be within your Medigap OEP for 6 months. So we count March, April, May, June, July, August. So, Willem, you have all the way up to the end of August to apply for a Medigap policy for an effective date of September 1 without any underwriting. Okay. Now, also, if you lose your Medicaid, I think they give you what we call a guaranteed issue right when you lose Medicaid. So that could be extended a little bit more. I'm not a Medicaid expert. I know Medicare well, Social Security well, but I do know for sure you have 6 months of the 3/1 date. So let's count it again: March, April, May, June, July, August. So you have all the way up to the end of August to apply for a Medigap policy, which goes in effect September 1. And it sounds like you're within that time frame when you mentioned a couple of months. All right, who's next? Hi, Marvin. Dante from Connecticut. I have a supplemental plan with Cigna. I've had to doctor visits, received a bill for $112. Do I have to pay the deductible before copays kick in? Okay. So what I'm assuming is that you do have a G plan. If you have a G plan, and this is your first claim for the year, Dante, then you're responsible for the first $257. So that $112, you would have to pay it. It's applied to the deductible. So once you've met your deductible of $257, if you're on a G plan, you should get no more bills. Everything else is going to be covered. As long as Medicare covers, that G plan will cover the balance. Now, if you have an N plan, what's going to happen, Dante, is same thing with the 112. You're going to have to pay your B deductible. And then after that, every time you see a doctor, you would have a $20 copay. Where G doesn't have any copays, the N does. All right. Who's next? Date of birth is June 6, 1960. Applying for Social Security and Medicare now today. Do they both Social Security and Medicare start July 1? Okay, no. They're going to start June 1. And so June, let's back up the clock, May, April, March. You're good, Sandra. So you're applying today. So both of those are going to start June 1 of 2025. Now, here's what happens, Sandra. If you applied for them on your Social Security benefits, they would have given you they would have asked you, when do you want to start receiving Social Security? So you would have had a couple different options of months to choose from. So I don't know what you chose. But if you chose to start your Social Security benefits in June, you're going to get your first check in July. And because you're born on the 6th, you'll get that deposit by the second Wednesday of the month. Now, if you told them to start your Social Security in May, you get your first check in June. Social Security is always 1 month in arrears. But Medicare is your birth month. So that definitely will be A and B starting 6/1/2025. So I don't know what how you responded to the Social Security question, but if you wanted June, check comes in July. All right, hope that helps. Let's keep going. All right, if I switch my full medical support to the Veterans Administration Health, is it feasible to discontinue my current supplemental plan in? Yes, it is. You can do that, Antonio. What will happen then is if you down the road change your mind and you want to come back in to a plan in and have a civilian option, then you're probably going to have to medically qualify to pick up that in plan. But you can do that. You can. And if you don't want to pay for that, I would tell you this: don't cancel Part B. I think that's a mistake. I know the Veteran Administration not going to bill Medicare or vice versa, but I still would stay enrolled in B. But if you don't want your supplemental plan, you can cancel that. If you know for sure you're going to be happy with the VA system for the rest of your life, that's a fine decision to make. Okay, next. All right, $3,500 dental card. Do I get that one time per year? Okay, Suni. I'm assuming you're talking about the dental benefit that comes with some type of a Medicare Advantage plan. I hope we're talking about that, and then that would be true. If it's a Medicare Advantage plan that comes with a $3,500 dental benefit, it will reset every January. That's the way that works. And what you have to pay attention to, Suni, is be sure you know how to use that benefit. Because with all Advantage plans, they advertise a benefit, but sometimes those benefits are hard to use. And I hope you don't find it hard to use. But make sure you know, do you have to use a network provider? What's that dental benefit going to look like? Is it going to cover extractions, fillings, root canals, crowns, all those kind of things? But get the details on how you get to utilize that full benefit. But the question, to answer your question, is yes, it'll reset every January. Okay. Social Security and then terminated wife for non-payment at the end of November, right? And ever should we sign back up during Q1 September or fight it? Okay, well, what I would do, Mark, I would go ahead and sign up, and it's not SEP, it's going to be GEP. So go ahead and do that now. That way, if you have any problems, if you sign up this month, you're going to have an effective on your B date of 4/1. The A date didn't change; you still have that. But the B date will then be 4/1 of 2025, and then if you want to fight it, you can. But do please, and it's real simple to do. You can submit what's called the CMS 40B form, CMS 40B. You can download that, print it off, and then take it to your local Social Security office. And I would put in the comment section, applying during the GEP, requesting an effective date of 4/1/2025. So that's the safe bet. And then after you've got that issued, then go back and try to fight with them to see if you can get it reinstated. Now, if you've had no claims, I don't think it's a big deal at all. Especially, Mark, you're going to have a new B date of 4/1/2025 if you want a supplemental plan. Now it's tied to April instead of being tied back to November 1. Okay? So hopefully that helps you. That's the way I'd handle that. All right, when does the income limit that you can earn end? I keep seeing something about 66 and 10 months. Okay. All right. So here's the way it works. Let's work yours out together. It's very simple, Debbie. You're born in 1959. That means your full retirement age is 66 and 10 months. 66 and 10 months. So the way we would count that would be, 66. So in 1/22/2025, you just celebrated 66. Your 10th month would be February, March, April, May, June, July, August, September, October, November. So 11/2025, later this year, you hit your full retirement age. So you are subject to an earnings test all the way from January, this past January, through October. Those 10 months, and during that time this year, because you're turning full retirement age, you can make $62,160 at your work with no penalty to your Social Security check. Now, had that been last year, it was lower. It's $23,400. But the year that you turn full retirement age, that earnings limit goes up a lot. And so this year it's $62,160, and you can make that much all the way through October. And then once you hit November, now it's unlimited. You can draw Social Security, and you can make $1 million a year. It doesn't matter. There's no impact to our Social Security check once we have reached our full retirement age, exact month and year. So that's your situation. All right, who's next? Okay, do we go to Social Security office to apply for Medicare A and B first before applying for an Advantage or supplemental plan? Yes, Cindy. But I wouldn't go to an office because you can do it online. Hey, and Cindy, call us. Let one of my agents do that for you. We do it for people all the time. There's no cost whatsoever. It takes about 7 to 10 minutes. And if you don't want us to do it, you can do it on your own. You just have to have a myssa.gov account, and you can enroll online for A and B. It's truly, truly simple. But if you're worried about it, a little skittish or whatever, call us. Let us do that. We're happy to do it. And then at the same time, then we can talk to you about supplemental plans or Advantage or whatever, and you can decide beyond that. But we do it every day, every single day. All day long, we're enrolling people into Medicare A and B, and there's no cost whatsoever. It'll be done right, and so let us take care of that for you. Okay? That's what I would do, or you can go online and do it yourself. If you do it to the local office, they're not going to want you to come anyway. You'd call the local office, set up an appointment, and they'll just do a phone appointment with you. Who's next? All right. If I use birthday rule, do you still get preferred rate on NU plan? Okay, NU plan. Okay, well, here's the bottom line. If you do use the birthday rule, there's no underwriting involved, and so you would get the standard rate. They kind of upcharge you because you use the birthday rule. For those of you who don't know what he's talking about, is there are some states, right now there's about maybe 14 states, 15 states, where once a year around your birthday, 30 days before, 30 days after, or 60 days after, they allow you, meaning the insurance companies, will allow you to change carriers and plans, sometimes both, sometimes just carriers, and to save premium, you can move from carrier to carrier. Move from a G plan with, let's say, United Healthcare to a G plan with Cigna. And you can do that with no underwriting if you live in a state where there is a birthday rule. No underwriting. It's not all year long except in the state of Washington. But everywhere else it's normally tied to your birth month. Again, 30 or 60 days prior to your birth month. And those states that have birthday rules right now are California, Oregon, Washington, Idaho, state of Nevada, Oklahoma, Missouri has an anniversary rule, same concept, Illinois, Louisiana, Kentucky, Maryland, maybe one or two others. But again, I think there's about 15 of them right now where they have birthday rules. Okay, let's keep going. We filed tax only, but my wife is not 65. Will my premium Part B be based on my income or both? Both, for sure. Yeah, anytime you file a joint return, they're going to look at your modified adjusted gross income. So if the two of you together are above 212 for this year, for 2023, that's this year's premium. They look back 2 years, so that'd be $212,000 or above. You're going to have an IRMAA. But if you have one of 8 life-changing events, you can always appeal the IRMAA as well if you have a work reduction or work stoppage or something. Okay, but married filing joint return. If you were married filing a separate return, that's even worse. You hit IRMAAs much, much quicker with those. So married filing a separate return is not always a good way to avoid IRMAAs. All right, let's keep going. Okay, how long does it typically take to receive a decision on an IRMAA appeal? Oh, usually about 2 weeks. But just be sure that when you appeal, that your forms are filled out correctly, that the life-changing event has occurred, and then submit it to your local office. And we like when people, if you can, drop it off at a local office. If you can't, mail it in, fax it in. If you fax, we always like to fax and mail, just in case they don't get the fax. So, yeah, you usually hear within, 2 to 3 weeks. It didn't take a long time. All right, who's next? All right, my Medicare and Sub G started February 1st, and both Medicare and my plan paid $0 for visits with my mental health therapist. Is mental health not covered? Well, mental health is covered. In fact, they expanded mental health coverage for 2025. However, you make sure that your mental health care provider does take original Medicare, because that's one of the criteria. They have to take Medicare A and B. They will take your supplemental plan if they take A and B. So what could happen here, could it have been that if you have a G plan, you do have a G, okay, that there could have been your B deductible has not been satisfied yet. Remember, that's $257. So it could be that that's why you're receiving a bill that you have to pay that $257, because this would be on the B side of Medicare. So let's check that out. Now, if they don't take Medicare, it's not covered. But if they do take Medicare, that $257 could be your deductible. And if you've already met the deductible, then don't pay the bill. Figure out what's going on. Maybe they miscoded or something. So we always tell people, if you have a G plan, after you paid your B deductible, pay no bills, give us a call and let's figure out what's going on. And we'd be happy to work with you on that if you're our client. All right, let's keep going. Okay, turn 65 at the 1st of February. I'm currently, if I'm working full-time, have good insurance, group insurance, plan to continue working until May of 2026. Should I apply for Plan A or just wait until then? Okay, David, my advice is, as long as you do not have an HSA, a health savings account that you're contributing to, I would take Medicare A only. I think it's good to do it. Now, the way it works, if you had a claim, hospital claim, A is in the second payer position. Group plan pays first, A pays second, but A does pay. They'll pay coinsurance. Part A in the second payer position pays no deductibles, no copays, but it will pay coinsurance. So if you got hospitalized and you have coinsurance responsibility, which most people do, on the hospital claim, then Medicare will pay. So I would encourage you to get A. So the only people I'd advise not to get A only at 65 are those that are contributing to an HSA. Because if you have an HSA that you want to contribute to and you enroll in A, you can put no new money in that HSA. So I think you just shot yourself in the foot. But if you don't have an HSA, take A only. That's a smart move. All righty, who's next? Okay, I guess we're done. Okay, sounds good. Hey, we appreciate it very much. Listen, folks, next Monday at 5 o'clock, I have a similar event. We take a topic, we call that Medicare Monday, and then next Wednesday, we're scheduled. And we usually do this on a Wednesday or Thursday. I think next week it works out for my schedule. I'll have this next Wednesday. So tell your friends about us. Give us a call if you need a good broker. It'd be our privilege to assist you in any way that we can. Give us a call. Thanks so much for watching. Have a good evening.